What is prediabetes? Prediabetes is a serious health condition, where blood sugar levels are higher than normal, but not high enough yet to be diagnosed as type 2 diabetes. This is known as insulin resistance. A blood sugar level less than 140 mg per deciliter, that is, 7.8 millimole per liter, is considered normal. A blood sugar level from 140 to 199 mg per deciliter, that is, 7.8 to 11.0 millimoles per liter, is considered prediabetes. A blood sugar level of 200 mg per deciliter, that is, 11.1 millimole per liter, or higher, indicates type 2 diabetes. What causes prediabetes? Insulin is a hormone made by your pancreas that acts like a key to let blood sugar into cells for use as energy. If you have prediabetes, the cells in your body don't respond normally to insulin. Your pancreas makes more insulin to try to get cells to respond. Eventually your pancreas can't keep up, and your blood sugar rises, setting the stage for prediabetes and type 2 diabetes down the road. Signs and symptoms. Prediabetes doesn't usually have any signs or symptoms. You can have prediabetes for years but have no clear symptoms, so it often goes undetected until serious health problems such as type 2 diabetes show up. Classic signs and symptoms that suggest you've moved from prediabetes to type 2 diabetes include increased thirst, frequent urination, excess hunger, tiredness, blurred vision. It's important to talk to your doctor about getting your blood sugar tested if you have any of the risk factors for prediabetes, which include being overweight. Being overweight is a primary risk factor for prediabetes. The more fatty tissue you have, especially inside and between the muscle and skin around your abdomen, the more resistant your cells become to insulin. Being 45 years or older. Although diabetes can develop at any age, the risk of prediabetes increases after age 45. Family history. Having a parent, brother, or sister with type 2 diabetes increases your risk for prediabetes. Being physically active less than 3 times a week. The less active you are, the greater your risk of prediabetes. Physical activity helps you control your weight, uses up sugar for energy, and makes the body use insulin more effectively. Ever having gestational diabetes, that is, diabetes during pregnancy, or giving birth to a baby who weighed more than 9 pounds, you and your child are at higher risk of developing prediabetes. Having polycystic ovary syndrome. Women with this common condition, characterized by irregular menstrual periods, excess hair growth and obesity, have a higher risk of prediabetes. Diet. Eating red meat and processed meat, and drinking sugar-sweetened beverages, is associated with a higher risk of prediabetes, while a diet high in fruits, vegetables, nuts, whole grains and olive oil is associated with a lower risk of prediabetes. Sleep. People with obstructive sleep apnea, a condition that disrupts sleep repeatedly, have an increased risk of insulin resistance. Tobacco smoke. Smoking may increase insulin resistance. Smokers also seem to carry more weight around the middle. Other conditions associated with prediabetes include high blood pressure, low levels of high-density lipoprotein cholesterol, the good cholesterol, high levels of triglycerides, a type of fat in your blood. When these conditions occur with obesity, they are associated with insulin resistance. Complications. The most serious consequence of prediabetes is progression to type 2 diabetes. That is because type 2 diabetes can lead to high blood pressure, high cholesterol, heart disease, stroke, kidney disease, nerve damage, vision problems, possibly loss of vision, amputations. Prediabetes has been linked with unrecognized, silent, heart attacks, and can damage your kidneys, even if you haven't progressed to type 2 diabetes. When to see a doctor? See your doctor if you're concerned about diabetes, or if you notice any type 2 diabetes signs or symptoms. Ask your doctor about blood sugar screening, if you have any risk factors for diabetes. Prevention. Healthy lifestyle choices can help you prevent prediabetes and its progression to type 2 diabetes. Even if diabetes runs in your family, try to eat healthy foods. Get at least 150 minutes of moderate, aerobic physical activity a week, or about 30 minutes on most days of the week. Lose excess weight. Control your blood pressure and cholesterol. Don't smoke. Early, decisive action can slow down, or even halt the development of type 2 diabetes.